Good morning, student. So today we are going to see about another topic under this unit, that is about national health policy. So you all know that there are different types of policies there in our country for the welfare and well-being of the local people, for the general public. So in that way, we are having a policy mainly to provide a welfare and well-being of the health of the public. For that, we have introduced this policy, that is National Health Policy. Coming to the details of National Health Policy, Ministry of Health and Family Welfare, Government of India evolved a National Health Policy in 1983. So since 1983, we are implementing this policy with various goals and objectives for the welfare and well-being of the general public, mainly in relation to health aspect. Main aim is to attain the goal for health for all by the year 2000. So we are supplementing with the services and the activities that is initiated by Health for All. Along with that, with this policy, various interventions are there which supplement to reach the Health for All by 2000. So activities are being implemented, and this National Health Policy is revised and amended in the year 2002, 2005, 2010, 2015. Presently we are running with the 2017 National Health Policy. So till 2015, what are the changes happened since 1983 for the health and health aspect? Health priorities are changing. Now presently the growing burden of non-communicable diseases and some infectious diseases are more. So that is the one change that presently we have to see for. Second is the emergence of a robust healthcare industry estimated to be growing at a double digit. Lot of hospitals and healthcare institutions are emerging one after the other. Even in one city itself, there are more number of hospitals and health clinics and institutions. So that is growing day by day. Growing incidence of catastrophic expenditure due to healthcare costs, which are presently estimated to be the one of the major contributors to poverty. Because normal people or below poverty line people, it is not affordable to them to get health services from these emerging hospitals and healthcare industries. The healthcare cost is increasing day by day. So that is another change. Next, last one is a rising economic growth enables enhanced fiscal capacity. So as the economic growth are rising, similarly the fiscal capacity, enhanced fiscal capacity are also get enabling. So these are the changes that is presently prevailing in our country. Therefore, a new health policy responsive to these contextual changes is required. So keeping in mind all these changes, we have initiated new target and goals for the coming National Health Policy. So now let us see about the policy 2017. Aim is achieving universal health coverage and delivering quality healthcare services to all at affordable cost. You can underline affordable cost. That is very important. Quality health services has to be provided with the affordable cost. So what is the goal? Attainment of highest possible level of good health and well-being for all at all ages through a preventive, promotive healthcare orientation in all development policies and universal access to good quality healthcare services without anyone having to face the financial hardship as a consequences. So as per this National Health Policy, what we are saying is that for all the ages, the health services must be accessible, and health services, it's not only curative, it must be starting from preventive, promotive aspect till rehabilitation. The services must be provided, and it has to be provided universal access in everywhere, from the remotest area till the city based. Everywhere the health services must be available, and the services, how it has to be, it has to be in a good quality and with the affordable cost. The person should not, after providing health services, the person should not hand up with financial hardships. So in that way we have to provide the national health services. So that is that is the goal of this national health policy. Coming to the objectives: to improve the health status in all the sectors and expand preventive, promotive, curative, palliative and rehabilitative services provided through public health sector with the focus on quality. So as I told in the previously about the goals, so from the preventive till rehabilitation, all the services are provided in all the sectors with a good quality services, and that is being assured in all the public health sectors. Now let us see, there are lot many goals. Major goals only I have depicted here. So if you want more to know about more and more number of goals, you can go through PARC test, or you can search it on in Google to get more and more targets and goals about national health policy. So coming to the major goals, that is increase the life expectancy at birth from 6.5 to 70 by 2025. So at the birth there is a chances, that is neonatal mortality and morbidity is very high because of sepsis, because of respiratory diseases, because of home deliveries without having sophisticated instrument or life-saving equipments to save the baby. So all these can be prevented and can be reduced, can increase the life expectancy by decreasing the mortality at birth by 2025. Reduction of TFR to 2.1 by 2020 by implementing and providing of uninterrupted supply of contraceptives and motivating the couples to use that. Thereby TFR rate can be reduced, total fertility rate can be reduced to 2.1. Reduce under 5 mortality to 23 by 2025. Lot of diseases we have started IMNCI and various other schemes are there that is being running, and there are national health programs that is running for the welfare of under 5 kids. Thereby how to identify the diseases that can be lead to mortality in under 5 age, and that can be made aware of the mothers, and it has to be treated and prevented, thereby can reduce under 5 mortality. Reduce maternal mortality rate to 100 by 2020, reduce neonatal mortality to 16 by 2025, increase health expenditure by the government as percentage of GDP from 1.15 to 2.5% by 2025. So it is a very good sign that health expenditure from the total GDP is being increased to 2.5%. So that is a good sign that government is identifying the need of the health services, thereby to provide these health services and implementing various national health program. From the GDP we are provided with 2.5% for exclusively for the health and health services. Increase state sector health spending to more than 8% of their budget by 2020. So that is also a good sign that from the state level also we are having a health expenditure for more than 8% is being utilized for health and health services. Ensure availability of paramedics and doctors as per IPHS norm in high priority districts by 2020. So identifying IPHS is Indian Public Health Standard norm. So based upon, we know that there is Indian Public Health Standard norm for uniform infrastructure and services for health centers and hospitals, etc. Similarly, for availability and for the provision of services by the doctors and paramedics also, the IPHS norm is being initiated. So accordingly, as per the norm, a sufficient number of these staffs must be available in all the health centers and health institutions, especially in high priority districts, based upon that by 2020. to reduce TB incidence of new cases to reach elimination by 2020.